Kia ora koutou katoa. Welcome again to the Ministry of Health, to our media stand-up today. I have with me Dr. Caroline McElnay, the Director of Public Health. And once again, as we have a sign language interpreter back with us today, thank you for including the interpreter in your picture. I'll start the stand-up today, as I do most days, to confirm that we still have no cases of COVID-19 in New Zealand and currently no suspected cases. To date, around 120 tests have been carried out and all of these have returned negative. Just regarding the travel restrictions, you will have heard yesterday after the Cabinet meeting in the morning, the Prime Minister confirmed that the current temporary restrictions on travel to New Zealand are to remain in place for another 8 days. This is part of our precautionary measures in our current Keep It Out phase, and those measures are being reviewed every 48 hours on an ongoing basis. Just to repeat, this is a precautionary measure, part of our overall COVID response. Just looking at other countries and what's happening globally, we don't have any confirmed cases in New Zealand, as I have said, but it's clearly still a rapidly evolving situation globally. You will be familiar with the numbers, I'm sure, in particular, the big increase in the number of cases in South Korea, as well as in northern Italy, and the quite stringent measures that have been put in place in both those jurisdictions in response to these numbers. At the moment, and in light of those developments, we have got a request for advice out with our technical advisory group, which meets on Thursday morning, and they are already actively discussing whether the changes we are seeing in countries like South Korea and Italy should change our approach, in particular our case definition, that is who we might have a suspicion of if they are symptomatic, and therefore move to testing. So we're expecting their advice on Thursday morning, and we'll be reviewing our case definition off the back of that advice. You'll also have seen to date a number of countries amending or updating their advice to travellers and their border measures. We, of course, are re-looking at our border measures every 48 hours as part of our ongoing review of the current travel restrictions, and we will continue that. To move now to Whangaparaoa, just briefly, the 6 people who are there who were repatriated after spending the time in quarantine on the Diamond Princess are all well and continuing their daily health checks. Lab testing, I've covered the fact that we've done over 120 tests already. At the moment, we just still have those 3 laboratories that are doing the testing. That's more than enough capacity at this point in time. But to point out that if we needed to scale up testing, we would be able to quite quickly extend that testing capability into other areas around the country in labs, which our district health boards have. I'm going to hand over to Dr. McElnay now a little bit more about our pandemic preparedness and a couple of the particular areas of work that are underway, building on what the Prime Minister said yesterday. Just to confirm, though, of course, we have not had a pandemic declared by WHO. We are doing this preparation to put ourselves on a footing that if a pandemic were to be declared, we would be ready to go and to modify our response accordingly in a timely way. Over to you, Caroline.
Thank you. Thank you. So I just want to touch first on the national supply of equipment. As the Prime Minister said yesterday, we have a ready supply of clinical equipment ready to be deployed as required. This supply is part of our general preparation for a pandemic and is constantly kept up to date. The sort of equipment that includes are masks, aprons, gloves, eye protection, and other clinical equipment such as syringes and IV fluids. Now, our technical advisory group are keeping up with the emerging evidence and the implications for this particular virus as to what actual supplies would be required should we be in a COVID-19 pandemic situation. And so that allows us to have an early indication of the critical items that we particularly need to address this COVID-19 situation. The full list of what we have in reserve is on our website. The other point I wanted to talk about was community-based assessment centres, and Dr. Bloomfield yesterday touched on the possibility of setting up community-based assessment centres in a pandemic. These have certainly been used effectively before in New Zealand, particularly in Canterbury, during the 2009-10 swine flu pandemic, and they were planned in other DHBs but were never actually used in those other DHBs. So they are a recognised way of being able to take the pressure off other health professionals and general practice. We are currently asking DHBs to plan for how a significant demand in primary care in their local areas could be best met, and to look at the options for doing these. And that would include the possibility of community-based assessment centres in those areas. As the Prime Minister mentioned yesterday, we have a network of clinical intensive care unit directors, and they have now met specifically around ICU, high dependency unit and negative pressure beds that we have across the country. In a pandemic scenario, we would use this group to provide advice on how best to manage demand for those beds across the country from a national perspective. It's important to note that these are beds that are already in use across the country. So part of the role of this group would be to advise on, their current role is to advise on the demand for these beds and equipment. And the next meeting of our intensive care network is tomorrow. So I'll hand back to Dr. Bloomfield.
Thanks, Caroline. And just to confirm, as I promised yesterday, we will be putting up the numbers and distribution of the ICU beds and the negative pressure ventilation beds on our website. We'll do that this afternoon. Right. Healthline, I really just want to continue to give the Healthline service a plug here. It's been one of the key mechanisms we've got in place for contacting and checking on the wellbeing and welfare of people coming back from China. And we've seen most of those people, about 2/3 of the people who have come in since the 3rd of February have now finished their 14-day self-isolation period. We still have over 5,000 people registered with Healthline, who have registered with Healthline, and around 3,500 of those are sort of active registrations. So my sense is that people have really picked this up and are registered, and it's a great way for us to both plan and also to check on their wellbeing. And I just want to finish with some comments about the Pacific, which I know is of interest as well. There's been questions about what we're doing to support the Pacific. And the first point is that there are no confirmed cases of COVID-19 in the Pacific as yet, and we're continuing to work alongside other agencies, particularly MFAT colleagues, on operational procedures for Pacific nationals who are turned away from their home countries because they may have been in China or travelled through in the last 14 days and are seeking entry to New Zealand. Now, we haven't had any of these as yet, but we're looking at that as a possibility. And the key thing here is we're really active in continuing to support preparations in the Pacific, particularly for those realm countries, Tokelau, Niue and the Cook Islands, and also how we might support them if necessary with quarantine of their nationals to prevent the possibility of infection being transmitted to those countries. Okay, just before I finish and we take questions, just to alert you, there's no media stand-up planned for tomorrow, depending on what happens, but we will put a statement out and then we will plan to have another stand-up on Thursday. So happy to take any questions.
Just to clarify, so after that Thursday meeting, if the advice is to change the definition of what a case is that when you would look at border controls to other countries?
They're two separate processes, but linked. And in fact, the main advice we're seeking from the technical advisory group is, because the case definition, as you'll know from our website, includes that they have travelled to or been in mainland China within the last 14 days. The key question is, should we add other places to that? For example, should we add Daegu specifically in South Korea, where there's quite a high number of cases? So we will get that advice. That will inform, but it's not the only bit of information we would use if we were to potentially look at further restrictions around travel. At this stage, we're not doing that, but we will look at that as part of our regular 48-hour review.
Do you have any advice for employers if coronavirus were to arrive in New Zealand?
Well, there's quite a lot of advice on our website. If we were to get a case and we were to get, several cases and we started to move to a sort of either a stomp it out or even more into a manage it phase, then we would absolutely have very specific advice for employers. At the moment, our advice is very much to support their employees to be able to, and to facilitate them to undertake self-isolation if they're returning from China. That's by far the most important contribution they can make.
How many critical cases can a country handle?
How many?
If we were to
Yeah.
put in ICU or those negative pressure rooms, how many can we handle? Yeah.
Well, did you want to comment? Yeah.
I think as part of our pandemic planning, what's really critical is you get an increase in cases, and it's not so much the actual number, it's the frequency with which those cases come. And that's where if we can have maybe a longer period of cases, they're more day-to-day basis. What is more challenging is if you get a lot of sick people all at once, all requiring intensive care facilities, for example. What's more manageable is to be able to space that out, and that is where our network comes in, because we need to know across the country where people could be cared for. So it's very hard to say if we had suddenly our capability for ICU beds. It would be quite challenging if we had a lot of cases all at once. So it's about smoothing that out.
What would be a lot? Are we dozens?
Yeah.
Or-
So if we look at the experience from other countries, including even Australia with its relatively small number of cases, it's a small proportion of people who require intensive care. So it's under 5%. So we've got somewhere around 240 ICU beds. And if you do the maths, obviously we're trying to, as Caroline said, what we're trying to do is ensure that if we do get an outbreak here, we're not getting it all at once. And so that's where the public health measures come to the fore and are a really critical part of both preventing and managing an outbreak. Of course, most people will have mild to moderate disease and will just self-manage at home. Some will require some attention in primary care. A smaller proportion will require hospital care, and then the smallest proportion will require ICU care.
Masks have been mentioned. I think a figure of 9 million masks or something like that we have. But you guys have said in the past that masks aren't particularly useful or helpful in this kind of situation. So is that a bit incongruous?
Yes, so the reserve supply of masks, 9 million surgical and 9 million of the N2, which are the sort of more the better masks, respirator type masks. Those are for use in healthcare and other settings where to protect healthcare workers, first responders, emergency responders, and so on. They're not there for the use of the general population, and they're available to primary care as well. So that's what they're there specifically for use in healthcare type situations.
Do you know how many people are contacting Helpline? You can updated numbers on how many people are signing in that are worried that they might have.
I don't have the numbers with me, but I do know that the number of registrations is quite low now. The main reason for that being that actually we're registering anyone travelling from China is getting registered at the border now. So we're basically capturing everybody. We can find the information and we'll supply that around just the number of calls to Healthline about COVID-19 and what the issues are people are concerned about.
And the 120 tests, what's happened to them and where are they in the country?
I don't know the details of that, and some of these people will have been tested in primary care because they may have possibly fitted the case definition, may have a history of travel to China, may have probably had respiratory symptoms. Some of them are people who have been treated in hospital. None at the moment. In fact, what I can say is only a small proportion of those people fitted the suspected case definition. The rest, it was part of what we call a differential diagnosis, so wanting to rule it out as much as anything.
The people that have the virus overseas, where are they now and have they been allowed back in the country?
The people who were in particular the ones in Japan.
Yeah.
Yes, I don't know. I don't know their travel. You'll know that 2 of those people with a family member have been discharged from hospital and they're making their own plans to travel back to New Zealand. Yes. Are there any other questions? If not, thank you again. As I say, no stand-up planned for tomorrow. We'll let you know if that changes, and there will be a statement, and we'll provide that follow-up information. Thanks again.